First aid for anaphylaxis from ReadySF. Anaphylaxis is a life-threatening allergic reaction that can cause shock and severe breathing difficulty. Unlike a mild or moderate reaction to an allergen, anaphylaxis is a life-threatening emergency in which the body overreacts to an allergen, flooding the body with histamines and causing the blood vessels to leak and the airway to close up due to swelling. While a typical mild to moderate allergic reaction can usually be treated with over-the-counter antihistamines, like Benadryl, anaphylaxis is a serious life threat, and the definitive treatment is epinephrine. The most commonly reported triggers of anaphylactic shock include insect stings, especially multiple bee or wasp stings at once. Foods, particularly peanuts and tree nuts, but possibly other foods such as milk and seafood as well. And certain medicines, such as antibiotics. Signs and symptoms of anaphylaxis include difficulty breathing. You may hear wheezing or high-pitched whistling as the patient tries to breathe, and they may only be able to speak a few words at a time. Facial and tongue swelling, or large area swelling of the face. And signs and symptoms of shock, like pale, sweaty skin, a high pulse, fast breathing, and anxiety. The first aid treatment for anaphylaxis is to remove the allergen if possible. Inject the patient with epinephrine if you have access to an EpiPen or auto-injector by following the directions on the pen. Do not delay administering epinephrine. Monitor the patient for a second reaction. Epinephrine acts fast, and you should see immediate relief of the patient's difficulty breathing. However, symptoms sometimes return, requiring additional treatment. There are multiple different auto-injectors on the market. Make sure you're familiar with your own prescription EpiPen or the EpiPens you have access to at work or home, and follow the directions on the pen. To use an EpiPen, grasp the injector in your fist, being careful not to hold your thumb over either end in order to avoid accidental self-injection. Remove the blue safety cap. Hold the orange tip against the middle of the patient's outer thigh. The needle is spring-loaded and able to inject even through thick clothing, including jeans. Push the injector into the thigh until it clicks, and hold it in place until the count of 3. When you remove the EpiPen, the needle should retract back into the pen, but be careful to dispose of the pen safely to avoid accidental pricking. Call 911 for any patient experiencing anaphylaxis, even if their symptoms are relieved by epinephrine. Any patient that has an anaphylactic reaction should be seen by EMS personnel immediately. Monitor the patient until help arrives. You may need to administer additional doses of epinephrine as needed. This is why some EpiPens come in 2-packs. To learn more about anaphylaxis, check out the American Academy of Allergy, Asthma, and Immunology at aaai.org. Thanks.